Lesson 7, Environmental Emergencies. We're going to get started with a video on heat-related illnesses.
Heat-related illnesses are caused by overexposure to heat and the loss of fluids and electrolytes. In order from least to most severe, the heat-related illnesses are heat cramps, heat exhaustion, and heat stroke. Heat cramps, which usually affect the muscles of the legs and abdomen, are caused by the loss of fluid and electrolytes due to sweating. Heat cramps are often the first sign that the body is having trouble with the heat. If not addressed, heat cramps can turn into heat exhaustion or heat stroke. To give care for heat cramps, help the person move to a cool place and sip a drink containing electrolytes and carbohydrates. A commercial sports drink is best, but if that is not available, you can give coconut water or milk, or if these are not available, water. Lightly stretch and massage the muscle. When the cramps stop, the person usually can resume activity. Encourage the person to drink fluids and stay hydrated, and watch the person carefully for additional signs or symptoms of heat-related illness. Heat exhaustion occurs when fluids lost through sweating are not replaced. The person's skin will be cool and moist, and either pale, ashen, or flushed. The person may complain of a headache, nausea, dizziness, and weakness. To give care, move the person to a cooler environment with circulating air. Loosen or remove as much of the person's clothing as possible. Cool the person's body by applying cool, wet cloths or spraying the person with cool water. Fanning the person may also help. If the person is responsive and able to swallow, give the person a cool drink. Remember, the fluids to offer in order of effectiveness are a commercial sports drink, coconut water or milk, or water. Encourage the person to take small sips rather than gulping the drink down quickly. If the person's condition does not improve or the person is unable to take fluids, has a change in level of responsiveness, or vomits, call 911 or the designated emergency number. The person should not resume activity for several hours after all signs and symptoms have been resolved and the person is adequately rehydrated. Heat stroke is life-threatening. The person will have mental status changes, such as confusion or loss of consciousness, and may have trouble seeing. The person may vomit or have a seizure. The person's skin will be hot to the touch. It may be wet or dry and appear red or pale. The person's breathing may be rapid and shallow, and the heartbeat may be rapid and weak. Call 911 or the designated emergency number immediately and take steps to rapidly cool the body. Immerse the person up to his or her neck in cold water if you can do this safely. Alternatively, place ice water-soaked towels over the person's entire body, rotating the towels frequently. If bags of ice are available, place these on the person's body over the towels. Apply rapid cooling methods for 20 minutes or until the person's condition improves or EMS personnel arrive.
So we're going to play fact or fiction again. I'm going to read out the statement and you try to guess if that was fact or fiction. So in order from least to most severe, the heat-related illnesses are heat exhaustion, heat cramps, and heat stroke. Is that fact or is that fiction? That is fiction. The correct statement should be, in order from least to most severe, the heat-related illnesses are heat cramps, then heat exhaustion, and then heat stroke. Next. The best prevention strategy for heat-related illnesses is to stay properly hydrated. Fact or fiction? That one is a fact. Staying hydrated helps to make sure fluids lost through sweating are replaced, which helps to reduce the risk for experiencing a heat-related illness. Water is the best choice of fluid for staying hydrated. Drink a few ounces every 15 to 20 minutes or however much you need to not feel thirsty. Heat-related illnesses only affect people who are outdoors. Fact or fiction? That one is fiction. Being outdoors is a risk factor for developing a heat-related illness, but these illnesses can also affect people who are indoors. People who live or work in buildings that are inadequately cooled or ventilated are at risk, as are those who perform indoor jobs in hot, humid environments, including kitchen and laundry workers. Heat stroke is life-threatening, fact or fiction? That one is a fact. A person who is showing signs and symptoms of heat stroke needs immediate cooling and medical attention because heat stroke can be fatal. If recognized early, heat cramps and heat exhaustion can usually be corrected with first aid measures. That one is a fact. When a heat-related illness is recognized in its early stages and proper care is provided, it can usually be reversed. If a person is experiencing signs and symptoms of a heat-related illness, is responsive, and is able to swallow, you should offer the person small amounts of a cool drink containing carbohydrates and electrolytes, such as a commercial sports drink, coconut water, or milk, or water if one of these options is not available. That is a fact. And now we're going to move on to cold-related emergencies. So our first example is hypothermia. Some signs and symptoms of hypothermia include the person may seem indifferent, disoriented, or confused. The person may have a glassy stare. The person may become unresponsive. Initially, the person may shiver, but as the core body temperature continues to decrease, the shivering may stop. This is a sign that the person's condition is worsening and he or she needs immediate medical care. You come across a person who you believe may have hypothermia. What should you do? Is it the first option, which is get the person someplace where he can take a hot bath or shower? The second option, give the person a shot of brandy or a warm cup of coffee. Or is it the third option, move the person to a warmer environment, make sure the person is wearing dry clothing and wrap him in a blanket? While all of these might sound like they could be potentially the correct answer, the third answer is the best one. That's because for the first answer, you wouldn't want to give them a hot bath or shower. You'd want to do a warm bath or shower because a hot bath or shower can lead to burns and what's called rapid rewarming. You want to warm them up gradually. The second option might seem tempting, but you wouldn't want to give them a cup of coffee or a shot of brandy. You'd want to give them some warm water. And the third option is the correct one. If you suspect that a person has hypothermia, you should call 911, move the person to a warmer place, remove wet clothing and dry the person, and then help them warm up gradually by helping him or her put on dry clothing. Maybe you have a hat, gloves, and socks, and then wrapping them in a blanket. Frostbite is an injury caused by freezing of the skin and underlying tissues as a result of prolonged exposure to freezing or sub-freezing temperatures. The nose, ears, fingers, and toes are most often affected. The frostbitten area is numb and the skin is cold to the touch and appears waxy. The skin may be white, yellow, blue, or red, and in severe cases, there may be blisters and the skin may turn black. So we're going to play some fact or fiction for frostbite. So first statement, frostbite can be treated by rubbing snow over the affected area. Fact or fiction? This one is definitely fiction. Treatment of frostbite starts with gradual rewarming. Rubbing snow or anything else on the affected area only causes additional pain and tissue damage. Next one, gently massage the frostbitten area to restore circulation and warm it up. Fact or fiction? While this one might seem like it could be the correct answer, it's actually fiction. You want to make sure to handle the frostbitten area gently. Massaging or rubbing the affected area can cause additional pain and tissue damage. Immerse the frostbitten area in hot water. Apply a heating pad or hold it close to a fire to rewarm the tissues. Fact or fiction? That one is fiction. Remember, rewarming the frostbitten area with direct heat can cause additional damage, including burns. So again, you want to use warm water and gradual rewarming techniques. If the frostbite is severe or the person is also showing signs and symptoms of hypothermia, call 911. Do not break any blisters and make sure to monitor their condition and give care accordingly. If rewarming is attempted, skin-to-skin contact may be sufficient to rewarm the frostbitten body part if the frostbite is mild. Alternatively, rewarm the frostbitten area by soaking it in warm water until normal color and warmth returns, about 20 to 30 minutes. After rewarming, loosely bandage the area with a dry, sterile bandage. Place cotton or gauze between frostbitten fingers or toes before bandaging. And our last topic is poisoning. Signs and symptoms of poisoning vary depending on the type and amount of poison taken into the body. Abdominal pain, nausea, vomiting or diarrhea, trouble breathing, changes in level of consciousness, seizures, headache, dizziness or weakness, abnormal skin color or sweating. These are all signs and symptoms of poisoning. Checking the scene and the person will often yield clues as to the cause of the person's illness. You want to look out for open or spilled containers, unusual odors, burns around the person's mouth or a strange odor on the person's breath, the presence of other people who are ill. To give first aid care for poisoning, first size up the scene and form an initial impression. Remove the person from the source of the poison if you can do so without endangering yourself. Take note of any clues that might indicate what poisoned the person. Try to find out the type of poison, the amount taken, when it was taken, and how much the person weighs. If the person is showing signs and symptoms of a life-threatening condition, such as unresponsiveness or trouble breathing, or if multiple people are affected, call 911. If the person is responsive and alert, you can go ahead and call the National Poison Help Hotline at this number here, 1-800-222-1222, and they'll be able to give you advice on what to do next.